Assalamu alaikum. I am Dr. Khadiza from Bashundhara Ad-din Medical College. Today I am going to discuss about WBC, that is white blood cell. In this item, we are going to discuss about the classification, normal count, morphology, development, properties, function, and leukocytosis and leukopenia. Firstly, we are going to discuss about what is WBC. White blood cell are the nucleated colorless cell of blood and are the mobile unit of the body's protective system. And the morphology is, it is about 10 to 20 micron in diameter, and normal count is about 4,000 to 11,000 per cubic millimeter of blood. Its lifespan is few hours to few days, and it is produced in the bone marrow, spleen and tonsil. In bone marrow, its ratio with RBC is about 1:50, and in circulation it is about 500 to 500:1. Now let us discuss detail about the WBC. When you classify it, we usually classify it according to the presence of granules. When granules are present, we call is granulocytes. When it absent, we call is agranulocyte. Granulocytes are usually three types: polymorphonuclear neutrophil, polymorphonuclear eosinophil, and polymorphonuclear basophils. And agranulocytes are two types: lymphocytes and monocytes. This is the figure showing different types of granulocytes. Picture of agranulocytes, lymphocytes and monocytes. These are the white blood cells. Another figure. Now let us discuss about hematopoiesis of WBC. WBC usually originate mainly from the mother cell stem, that is multipotent hemopoietic stem cell, and then it is divided into two types of community, that is common myeloid progenitor and common lymphoid progenitor. From common myeloid progenitor comes basophil, lymphocyte and eosinophil, and from the common lymphoid progenitor comes the cell lymphocytes, that is T lymphocyte and B lymphocytes, as well as plasma cell. Another figure, here is another figures of all blood cells. Here you can see the proportionate variations of different cells. Now let us discuss about the differential count and normal count. Its normal count is about 4,000 to 11,000 per cubic millimeter blood. Differential count is actually count of the cell in 100 cell. So neutrophil is the more present more in percentage, that is 50 to 70%. Then lymphocyte, that is 20 to 40%, and other cell are that is eosinophil 1 to 4%, basophil 0 to 0.4%, and monocyte 2 to 8%. Absolute count is usually count in per cubic millimeter blood. Neutrophil is about 3,000 to 6,000 per cubic millimeter blood. Eosinophil 150 to 300, basophil 0 to 100, and lymphocyte 1,500 to 4,000, and monocyte is 300 to 600 per cubic millimeter blood. Now let us discuss the lifespan of WBC. Granulocytes, once released from the bone marrow, it stay 4 to 8 hours in the circulating blood, and another 4 to 5 days in the tissues. And monocytes that in blood it is about 10 to 20 hours it can live, and in tissue it can stay for months to years, and lymphocytes it usually live about weeks or months. Now discuss about the properties of the WBC. The properties are margination, diabetes, amyloid movement, chemotaxis and phagocytosis. This is the figure. You can see the different properties like margination, diabetes, amyloid movement and chemotaxis. Now discuss about the margination. Sticking of the WBC to the vascular wall is called margination. Here granulocyte and monocytes in the blood usually sequestrated to the capillary due to the margination. During inflammation, the inflammatory product act on capillary wall, and the endothelial cells become sticky to the capillary wall and causing extreme amount of margination of granulocytes and monocytes. Diabetes, it is another property. It is the process by which WBC come out through the pore of the blood vessels by squeezing. Then WBC come out for the vessel wall, then small protein portion of the cell squeeze out through the pore of the blood vessels, then continue squeezing and then come out from the vessel. Usually neutrophil and monocyte squeezes through the pores of the blood capillaries by diabetes, and WBC enter the tissue space by diabetes. In this figure you can see how the WBC come out from the blood vessel through the pores. Now discuss about the amoeboid movement. It is another property that the WBC move. It is the special type of movement by which WBC moves towards the damaged tissue. Both neutrophil and macrophage move through the tissue by amoeboid movement. This movement begins with protruding of formation of a pseudopodia in one end of the cell. Then the pseudopodium projects away from the cell body, and then remaining portion of the body moves towards the pseudopod. Now chemotaxis. A number of different chemical substances are liberated by the damaged tissue, causes both neutrophil and macrophages to move towards the source of the chemical, is known as chemotaxis. The process of chemotaxis is mediated by the chemical agents called chemokines, which are released at the infected site. Chemotaxis is effective up to 100 micrometer away from the inflamed tissue. During inflammation, the following substances are causes chemotaxis. These are the bacterial toxins, degenerative products of inflamed tissue, reaction products of complement complex, reaction product of blood clot. Now phagocytosis. This is the process by which WBC engulf the foreign earth particles. It depends on the rough surface of the foreign particles, absence of protective coat, and also opsonins. Factors affect the phagocytosis. We have already discussed about this. Now the mechanism: recognition, attachment and engulfment, killing and degradation. You can see how the neutrophil in the basal wall goes rolling, then goes to the basal wall, and then adhesion, and then squeezing, then out of the blood vessels, and then causes phagocytosis. This is the figure how phagocytosis causes engulf particle, and the particle is digested within the cell. You can see the first event, that phagocyte adheres to the pathogen, and then phagocyte forms a pseudopodia that eventually engulf the particles, forming a phagosomes, and then lysosome fuses with the phagocytic vesicles, formation of lysosome. Then lysosomal enzymes digest the particles, leaving a residual bodies. Then exocytosis of the vesicle form indigestible particles to remove out from the cell. These are the steps they have already discussed in the figure. The steps we have already discussed. Usually the digestion occurs by the lysosomal enzymes. This enzyme contain oxygen derivatives that kills the bacteria and digest them. These are some figures. You can see the slides. These are under microscopic figures. So that's all for today. In this class, we have discussed about the detail about the WBC, its normal count, its properties in detail. Next class, we are going to discuss about the morphology. So, Assalamu alaikum.